places. But
Right.
again, that does bring the problem out with overuse injuries and repetitive use injuries, things that you normally would see in an adult. A lot of these kids, 11, 12, up to 16, 17 years old, get, and it becomes even more problematic when you're looking at the high school age kids that are now in their varsity teams that now are prepping themselves for a possible college scholarship. At that point, it's almost like treating a professional athlete nowadays, because even though they're injured, you got to keep them on their feet. You got to keep them playing, because the scout is going to be there on a certain day.
Right.
So these are all things that we as podiatrists have to see and actually have to contend with to treat our patients and also keep them active enough so that they don't lose any of their activity.
One of the problems with a lot of kids is that they won't, either they have a very high threshold for pain, or they won't notice it or won't complain about it.
Sure.
So as a parent or a podiatrist, what do you look for to try and prevent an overuse injury? How can you tell if your teenage or young child is perhaps being overused?
You do want to look at their, their gait, how they're walking. I mean, if they're walking, you're noticing there's a noticeable limp where there wasn't one before. Are they being protective of that side? Are they saying they're sick and they really don't want to go to practice that day? That's one indicator. And then making them show them their feet, just to make sure that there's no swelling, that there's no heat, that there's no redness in that area, any visible signs of trauma or inflammation. Very, very important. Again, even an ingrown nail, I can't say how many children hide ingrown nails. A lot of the children that come to see me, even up to 17, even adults that I have pick at their nails. Instead of cutting them straight across, they leave irregular borders and they get ingrown nails at that point. And especially children, they know what's involved, they know it hurts, they realize it's going to hurt to try to get that portion of the ingrown nail out, and they try to hide it. So again, if you notice that they're having difficulty, they're wearing more sandals instead of wearing their regular shoes, and they're trying to hide something from you, I do recommend that you at least take a look at it, and then we're here and available to take care of those children if they need it.
What are some of the more common specific kinds of injuries you see in young, very active kids and teens?
A lot of turf toe, where actually
That's a good. Let me just interrupt you, because we see that on sports broadcasts a lot.
Sure.
Wide receivers, quarterbacks, things like that have turf toe. What exactly is a turf toe? Could you define it for us?
A turf toe basically is an irritation of the big toe joint, just by the ball of the foot. It could be because of a jamming of the toe. It could be a little bit of a problem with what's called the sesamoids. All the textbooks say that there's 26 bones in the foot. Actually, there's 28, because underneath the big toe, if you point just a little bit further back, right there is the ball of the foot, and underneath there, just like you have a kneecap that holds your leg in place and holds your leg in alignment, there are two little kneecaps that you have underneath that big toe, and they're called sesamoids, just like your kneecap is a sesamoid. And what happens is either the sesamoid apparatus gets irritated just a little further back towards right there at the ball of the foot. Either the sesamoid apparatus gets injured or sprained, or there is some form of a injury to the joint itself. You can actually have what's called an osteochondral injury, where you can actually fracture the cartilage within that joint as well. So there are different grades of turf toe.
Great. That was very thorough. Thank you. What about ankle injuries and even soft tissue to like the Achilles tendon, which is a very delicate sort of area?
Sure. As I said, stretching of the Achilles tendon before and after activity, especially for impact sports, football, baseball, that type of thing, is extremely important, especially in the younger patients who haven't developed fully or haven't grown fully. It's as important, if not more important, than adults or professional athletes that are doing that. And you'll see all the baseball players out on the field just before the games, and they're stretching out their quadriceps, hamstrings, they're stretching Achilles tendons, just so they don't have the type of injuries that you might have recently seen even with the Olympic trials right now, where you see these runners running, and if if you see the sprinters, they're up on their toes the majority of the time, and that gives you a functional shortening of the Achilles tendon. And all the injuries usually happen right after the race because now they're trying to plant their foot flat, and you see that the Achilles tendon has now been strained. So those type of injuries happen just as easily to children as they do to these professional athletes. So again, stretching is very, very important for these children. And again, noticing that there's a problem, noticing that there's pain from overutilization. Pain is there for a reason. Pain is there to tell you you're overdoing it, calm down, or something more major is going to happen.
We just got a call. They didn't want to go on the air, but they wanted to pass this question on to you and give an answer, if you would. A caller wants to know what an ingrown toenail is.
Okay, well, the nail itself, I'm not sure if you have a nail picture there, Chris, but the nail itself on the borders becomes irritated or inflamed, and that's called a paronychia. If it becomes infected, at that point it becomes pyogenic. That won't show the nail, but that'll do. But what happens is right on the nail borders itself, there's an irregularity, or the child may have a congenital, what's called an incurvation of the nail, where the nail, instead of growing flat, has more of a U shape at the front if you're looking at it head on. And what happens is that can get irritated, whether it's from the shoes we were talking about, improperly fit shoes, or the shoes are too small. They'll irritate that area, and the nail will actually irritate the tissue in that corner, and at that point, if the irritation is progressive, it can actually become infected, or what's called, as I said, a pyogenic paronychia. I hope that answers your question. The way to treat it, though, is you should go somewhere professionally where the nail can be cut straight, so that the pressure can be relieved, and so there is no further problems with infection. You want to drain all that purulence or that infection out of it.
Great. Well, we hope that answered the question that the caller had in. We're down to about a minute left. I just want to put a plug in for the IPMA website for all the people watching. If you do not have a regular podiatrist now, please go to the website at ipma.net or call the 800 number. That's 888-869-3338. You can punch in your zip code and get a full list of podiatrists in your neighborhood. And these will all be IPMA members. And of course, we know those are the best podiatrists.
Of course.
Just to close out, in the next month or so, we're going to be talking about foot surgery. And pretty soon, we're going to have, every fall, the IPMA has a call-in promotion where anybody with a question about their foot care can call in a prearranged 800 number, and you'll talk to a live IPMA member. Look for that promotion on this show probably next month or the month after that, and we'll be able to take the message of Feet Forward to the whole state through an 800 number and the generous volunteer time of Illinois podiatrists around. Thanks for your time, Dr. Padata.
Chris, thanks for having me. I hope we've helped out a little bit. And again, call your podiatrist. We do know what we're doing as far as the feet go.
Okay.